keynote on the healthcare IT strategies by Mr. Arun Goyal, CIO, Sir Ganga Ram Hospital, New Delhi. Mr. Goyal has 30 years of experience in government and corporate at CXO level, spanning across industries including ITES, healthcare, and digital health. He has previously worked with IQVIA, QNew Labs, and Healthcare Global Enterprises. Please welcome Mr. Goyal.
Thank you very much for inviting me and give me opportunity to present on healthcare IT strategies on digital transformation. Let me share my presentation. So good afternoon, everybody. This is Arun Goyal, CIO from Sir Ganga Ram Hospital. I'll be sharing my views on healthcare IT strategy. So before we start visualizing IT healthcare strategies, I would like to share what should be our vision and what should be our mission while designing the healthcare IT strategies and how it should be created. And at the end of the presentation, I'll be taking you through the National Digital Health Mission's perspective also in line with the IT healthcare strategies currently. So our vision should be wherein we create a healthcare system which can use information to engage individuals, provide a lower cost, high quality care to improve individuals' health, to achieve the mission to improve the health and well-being of the individuals using technology and health information which is accessible as and when it matters most. So while creating the IT strategy, we should keep healthcare principle in mind. On the top of the mind, we should be keeping patient first, where patient can be on the top of the mind, creating all type of strategies and digitization of the healthcare, where patient can have a proper access to the clinician. They can have all the clinician and healthcare facilities sitting from home. They can create the appointment and achieve the appointments and have access to the clinicians and the hospital. Clinician can provide their consultation to the hospital, to the patient at their home, and deliver all the reports, prescriptions digitally to the patient. In case patient is coming to the hospital, he feels he have in the current scenario, he have all touchless experience in the hospital. When he comes, he have a QR codes, etc. He gets all registration on his mobile, or if he is not carrying the mobile, it is available on the display. All those facilities should be available with the patient. That type of strategy should be kept in mind while creating the IT strategy. As I explained to you, the accessibility to the patient, be it at home or at hospital, for the clinical advices or for the prescription or the pharmacy or the diagnostic reports, we should make our IT systems in a way that patient should have access to all such type of application and systems so that he can avail the services digitally. Simultaneously, in the coming era, this is in line with the current patient and individuals data privacy law, which is on table. So we should keep patient's privacy also in top of the mind while creating the system. This is in line with the National Digital Health Mission's principle, wherein the patient privacy has been kept in mind while we are creating any data or sharing any data of the principle of the patient. Patient is the principle of the data. So we have a consent of the patient and he is aware that this data will be used in what fashion. If he doesn't provide the consent, we should move accordingly. We should keep in mind that by providing the IT strategies and creating the healthcare system, we have a qualities in the mind, wherein we are making all the systems in compliance with the healthcare quality standards, making all the systems interoperable, because in the future and in coming times, in line with the National Digital Health Mission's principles, all healthcare facilities will have to have their data portable among all the facilities, be it hospitals, diagnostics, laboratories, and pharmacies. So all the data should be interoperable. So we should create our strategies and systems in a way that there is an interoperability among the systems. This can be achieved through all various type of innovations, wherein all health exchanges are there. We would be having a health data exchanges in due course, wherein we have to connect with the data exchanges with the technological innovation, and we can transfer our data links from one facility to other facility. And simultaneously, while we have uh, those uh, uh, mm, those things in mind, we need to make sure that we are addressing the current challenges into the healthcare, like all the healthcare facilities patients have to spend in manifold. So we need to make sure that how we can reduce the patient's burden on the healthcare and reduce increasing healthcare spend. We, by improving the quality and standards and for making IT systems quality compliant, we can improve the poor health outcomes. As I told in the earlier slide also, this is also a challenge in current scenario where we have very few doctors per patient in India. We can provide access to the care to the patient in the remote areas and fill that particular gap of clinicians deficiency and the bed facilities. While we will be providing all these facilities through the IT digitally, we need to make sure that all the data are secure and nothing is happening and man in the middle attack, etc. are not happening, and somebody is not hacking our data, healthcare data. So we need to make sure that this is all secure, portable, and following all the health standards. At the end of the day, in the center of all the services, our target should be that we should be able to provide electronic health records to the patient. So this is how we have these opportunities in front of us while creating the IT strategies to create systems which are empowering patients, are interoperable, having a new technologies in place, reducing regulatory burdens, addressing data privacy, following healthcare standards, securing information, and above all, with all these information, we are able to do the data analytics with all the data we have available with us to create the future healthcare policies and make sure that we have enough data to provide or improve our healthcare system better with the available data with us by data analytics. So this is a framework, strategic framework, which I have come up with, wherein I know we need to create our strategy in 4 blocks where we can improve the health and wellness of the patient, enhance patient's experience, and build secure data-driven ecosystem and connect healthcare data across the health systems. So how do we promote the health and wellness? So health and wellness can be improved by providing the access to the individuals to usable health information. So that can be achieved in a way wherein you can provide a cumulative reports to the patient, wherein patient is aware that how, for example, how their diabetes are increasing with the consultation or with the advice of the clinician, how their healths are improving or deteriorating. So with that information, patient will become a proactive and can have a better health care of himself. By providing advanced healthy and safe practices through health IT is, when we will be following all standards, the global standards into the healthcare system, our care will be very proper and accurate, and our care efficiency will improve. And we would be following all type of protocols in the healthcare system once we keep this thing in mind. Integrating all the health and health services information. So this can be achieved by addressing all the patient's need, wherein in the follow-up cases, patient needs follow-ups, where patient forgets to follow the prescriptions and medicines at home post their discharge. So we should create a system that patient get help and advices sitting at home, so that their health can be that gets improved and they recover fully, and they do not need to come to hospitals again and repeat the advices. Enhancing experience of care. this is the one area where all the hospitals and diagnostic laboratories and all the healthcare system needs to work upon by leveraging healthcare IT to improve clinical practices and promote safe and quality healthcare. So this can be achieved by providing patients quality care and all the day-to-day their action items digitization, wherein when patient comes into the hospital, they get lost where to go, how to go, where to approach, rather than approaching at a one place. So they should have some system in place so that they can direct it to the patient, to the clinician, and all the processes are available on tip of their mobile, and they are aware where to go, how and what to do, and what all pre-analytical or pre-consultation processes needs to be furnished, so that they feel not lost into the hospital or anywhere where they are going. We need to use health IT to expand access and connect patients to care. So that, as you know, in the COVID area, we have experience in the digitization. We need to bring in touchless experience to the patient, wherein we need to make sure that telemedicines are implemented into the system, so that your clinicians are available online based upon appointment to the patient. Patients, if they are visiting into the hospital, they are receiving digital invoices. They are not receiving hard copy invoices. So these are the small tips and advices which we need to make sure, wherein when we are creating IT systems strategy to help patients and make sure their experiences are enhancing. So this is how our IT healthcare IT can help them. Simultaneously, when we are building a system, we should make sure that all the regulatory requirements, be it NABH requirement or NABL requirement or a security requirement, all are in line with the guidelines, and all the regulatory actions are taking care, so that all the things and logs are maintained for the regulation point of view, which will help us in improving our healthcare system. Enable efficient management of the resources using health IT means, we can implement telemedicines to improve access to the patients in the remote areas for the clinicians, where clinicians are not able to go. We can improve teleradiology, wherein we don't have a radiologist with us in the hospitals. We can use radiologists sitting across the nation to provide faster turnaround time to the patients. So these type of facilities can be implemented into the system, so that patients feel more enhanced experience using the healthcare IT system. So while building a secure data-driven ecosystem, we need to make sure that all the systems, be it on the cloud or in-prem, are secured, encrypted, and access to the system, access to all the systems. Those are on the cloud or otherwise on premises are getting accessed by authentication and authorization. And we need to make sure that all the systems which are sitting on the cloud are encrypted and getting access through secured systems. We need to connect healthcare data in a way where we advance the development and use of health IT capabilities, as explained into the earlier slide. Establish expectation of the data sharing as we will moving on, and we will be adopting Ayushman Bharat Digital Mission. All the facilities would require to share the data across the nation, across the facility, among the patients and clinicians. So that type of expectations needs to be established. In communication infrastructure in the same line, wherein you make sure that your data and your data links are getting transported from one facility to other facility using data healthcare exchanges. So that is how we need to enhance our technology and communication infrastructure. Fourth D point is that promote secure healthcare information practices that protect individual privacy. So this we can achieve making a system wherein this is another initiative by the Government of India, by National Health Authority, wherein every patient's data is getting shared based upon their consent, which is getting authenticated by the central server, and based upon their consent for the particular period and duration, and for the particular data, only we are sharing patient's data and keeping that data. So that way patient will get a confidence that their data, healthcare data, is not getting misused. And if it is getting used, it is being used based upon their consent. So that is how we will, so what we could be doing during this course to achieve the strategic framework is we should be using a secure standard-based APIs. We should be following up HL7, Fire 4 standard across the systems while in exchanging the informations. We should participate in data exchanges through healthcare exchange network. We should be following all the global standard ICD 10, 11 or SNOMED CT or LINC standards for the respective streams. So, I'll stop here, and I would like to explain here. This is what is the National Digital Health Mission has conceived for all the data which is going to be shared across the nation, across the facility. So three layers of data, three layers have been conceived, where one is the data layer, where all your HIS, your clinicians and your e-portals are sitting, where patients are accessing either physically or electronically. So those data are sitting in the respective EHR systems or HIS systems. Those systems will get connected through respective health information exchanges, HIEs. So if one hospital, patient is accessing one hospital, I'll explain it to another slide in a more elaborative way. So if patient is accessing hospital for the services, those hospitals and laboratories and clinics are categorized into the health information provider, and all the users, be it the patient himself or the clinicians or the hospital or laboratories, those need that health information. So patient will access them. Based upon the access, they will ask patient for the consent. Patient will send the request to the consent manager at the gateway. Gateway, based upon the authentication of the patient, will send the information to the respective hospital where patient's information is sitting, fetch the information and send it to and display it to the health information user. So this is how going forward the consent and data flow will be there for the patient, which is envisaged into the NDHM. Just for making more clear, the next slide will make it more clearer, where how consent and data flow will happen. The health information users are in this box, and health information providers are in this box. So patient access the health information users, be it hospitals, insurers, doctors, specialists, or health locker. So if once patient needs all these things, they need patient's data. So they will request patients to share the consent. Patient sends the request to the health data consent manager. Based upon patient's authentication, health data consent manager sends the information to the respective data repository, which has got a patient's data, be it hospital, laboratory, any e-portal, or hospital or any clinic or nursing home. Based upon the instruction coming from the consent manager, they release that information and send the data in the encrypted form to the health information user. This is how the whole consent and data flow happens. So this is how we should be creating a health IT strategy, which will fulfill the India's digital dream, which is going to happen, and which our government has conceived and implemented. Thank you very much.
Thank you so much.
I would be happy to take any questions.
Yes, Mr. Goyal, I'm just looking if there are any questions that have come in now. So far, I've not been able to see any questions coming in on the platform as such. But thank you so much for your presentation. The National Digital Health Mission is certainly an exciting idea. And let's hope that this idea comes of age and we are able to have patient records which are digital. That will really streamline a lot of the administrative work that hospitals have to put in. And once they are freed up, let's hope that they will be able to put in their efforts into taking care of their patients, and we'll have much more happier patients. Thank you so much, Mr. Goyal, for joining us this evening. Thank you.